me see here. So there are over 100 different types of arthritis. Arthritis can affect anyone at any age and is one of the top causes of disability due to chronic pain. Since there are so many types of arthritis and so many different people are affected, it's only right that we examine these arthritis. There are two main categories. First category is the degenerative type, and the second category is the inflammatory type. So degenerative arthritis causes damage to joints, commonly referred to as wear and tear variety, while inflammatory arthritis involves the immune system, and they are commonly called autoimmune disorders. These disorders cause the body to mistakenly attack itself and causes damage inside joints. A sign of inflammatory arthritis is the presence of white blood cells in the joints and joint fluid. So the synovial fluid is usually populated with a lot of white cells. And this is one way of telling that there is an inflammatory process going on. The etiology or cause of arthritis isn't completely understood. It can begin unexpectedly, and arthritis usually mimic other disease, and so it defies treatment, and the physician has to perform several laboratory tests as well as examine the patient using x-rays and physical examination to determine what kind of arthritis the person has. I still don't like the light. Okay, so let's move on to the degenerative type of arthritis. And, well, back up. Before I get to that one, let's talk about septic arthritis. Okay, septic arthritis can be very detrimental because this is a type of arthritis where the bloodstream becomes septic, and one can die if this is not treated as soon as possible. I'm gonna change the light again. I'm gonna change it to a whiter light. Yeah. No? I don't know. I'm not having a good light day. I have to play with this some other time. All right, so septic arthritis is painful infection in the synovial fluid of a joint and joint tissue. The infection originates in other parts of the body, and the germ travels through the bloodstream and reaches the joints. Septic arthritis can also be the result of a penetrating injury which delivers germs to the joints. In other words, if you step on something and it punctures your skin, you can introduce bacteria into your bloodstream, and this may cause septic arthritis. This type of arthritis commonly affects the knees, but it can also impact the hips, shoulders, and other joints also. Bacterial infection from septic arthritis can start as a skin infection or a urinary tract infection, and also from a viral or fungal infection. The body reacts to the infection with inflammation, increasing pressure, and a reduction of blood flow within the area, which only advances the damage to the joint. The most common cause of septic arthritis is bacterial infection with Staphylococcus aureus or staph, which often cause skin infections. Other bacterial infections that may cause septic arthritis are Haemophilus influenza, gram-negative bacilli, streptococci, and gonococci. Prompt treatment is advised because this infection can quickly and severely damage the cartilage and bones within the joint, not to mention causing septicemia on a whole, which can kill someone very easily. Treatment involves antibiotics, which should be taken as soon as possible. If the septic arthritis is caused by a virus, then other means of treatment will need to be used other than antibiotics. You can also use medication for pain and fever. Physical therapy and other treatment is needed to alleviate pain. Okay, so that's septic arthritis. Now let's talk about the degenerative arthritis. The main degenerative arthritis is osteoarthritis. This most common type of arthritis, degenerative arthritis, is also known as osteoarthritis. This wear and tear variety of arthritis occurs when joint cartilage and the bone within the joint begins to wear away. The breakdown of cartilage that cushions the ends of the bones where they meet to form joints starts to become painful as the erosion worsens. While any joint can be affected by this type of arthritis, degenerative arthritis is usually seen in the larger bones, such as the hip, the knee, and the lumbar section of the spine. Degenerative arthritis is common in adults over 65, but as I said last week in that live, that I've seen instances where degenerative arthritis starts to develop in individuals in their late 40s and 50s. Okay, so degenerative arthritis can start with several things, including a joint injury, the stress of obesity on the joints, a disease that damaged the joint tissue or bone, a congenital disalignment of the bones, or loss of muscle strength that supports the bone. Damage to a joint progresses faster than the body's ability to repair itself, especially in older adults. Treatment in mild cases can be as simple as heat and ice compress. Resting can relieve the pain, and take some time throughout the day to mildly rest the affected. For more severe cases, injections and surgery are available if recommended by your physician. Now, there are two other types of arthritis: shoulder arthritis and spinal arthritis. Some scholars have lumped those two under their own topics, but I am going to discuss them under degenerative arthritis because to me they are a form of degenerative arthritis. So let's talk about shoulder arthritis. The shoulder has two joints, but shoulder arthritis usually refers to the glomerular, the glenohumeral joint, the major joint connecting the scapula and the humerus joints. Shoulder arthritis happens when the cartilage starts wearing down on the ball or socket side of the shoulder joint. When this happens, the cartilage gets soft and starts to develop cracks in the surface. Over time, cartilage begins to deteriorate and flake, then eventually wears away to expose the bone's surface. Without the lubricated cartilage surface, the bone rubs against each other and causes inflammation in the shoulder joint. Shoulder arthritis can be caused by osteoarthritis or rheumatoid arthritis. Other causes may be issues such as rotator cuff tear, arthropathy, or a vascular necrosis. Non-operative treatment includes stretching, using range of motion, and exercise. Lifestyle modification, application of heat or ice, and medication for pain relief. Physical therapy can also be helpful if the shoulder arthritis causes you to lose range of motion. There are other types of medical treatment options as well. Two types or injections are available. You have cortisone shots and hyaluronic acid. Arthroscopic shoulder debridement is a minimally invasive procedure that essentially cleans out the shoulder, which may provide pain relief, but it is not recommended if you have bone-to-bone traction. If the non-operative options don't work for you, shoulder replacement surgery may be your only option. Okay, so that is shoulder arthritis, and now I'm gonna add to that spinal arthritis. Give me a second, let me find that. So, spinal arthritis. So, as the name suggests, spinal arthritis is felt in your spine. It's usually called lumbar arthritis. It is very common and affects the spine, as I said. It's part of the wear and tear variety of arthritis that develops gradually and involves the facet joints and disc space in the back of the spine. Spinal arthritis is usually associated with spinal degeneration in adults. And this is why I think it's pretty much a degenerative disease and not a disease of itself. Over-the-counter non-steroidal anti-inflammatory drugs, so these are NSAIDs, can ease pain and reduce inflammation. Prescription medication can be obtained also. Now, lifestyle choices can also help in your treatment, such as weight loss, taking pressure off the joint, or adding inflammation reducing, or taking away inflammation reducing foods from your diet. Stuff like kale, walnuts, blueberries, tomatoes, etc. If you are a candidate for surgery, this should be discussed with your physician. Okay, so those arthritis are degenerative. So next I'm gonna go to reactive arthritis. Okay, so this is the third type. I discussed before degenerative and septic, and now I'm going on to reactive arthritis. So this is a chronic form of arthritis that comes from infection of the genital, urinary, or gastrointestinal system. Pain, stiffness, redness, or swelling in a joint as the lingering result of a previous infection that seems to have come out of nowhere. So, in this kind of infection, it's kind of a secondary infection, because what happens is you have either a urinary or a genital infection or gastrointestinal infection, and once that probably goes away and you think everything is okay, then you comes down with this infection and you're wondering, what causes it. So this is the nature of reactive arthritis. The infection could have been from a variety of conditions, including salmonella or chlamydia. Usually, only a single joint is involved, but over time, more joints may be affected. Reactive arthritis is often found in the joints of the lower limbs, but it can affect the upper limbs too. This type of arthritis typically affects those who are between 20 and 50 years of age. While reactive arthritis is not contagious, the infections where it originates might be. Certain types of black bacteria cause reactive arthritis, but you may not readily connect your infection to the arthritis because there is a lag time of several days or several weeks between the infection that caused the arthritis. So chlamydia and gonorrhea infection are two infections that can cause reactive arthritis. Okay? So it may also be attributed to genes, because people who get reactive arthritis often have the HLA-B27 gene. So that's something important to keep in mind. As in most cases, treatment depends on the individual. Antibiotics will treat the infection itself, and medication can reduce the inflammation. Rest is recommended to ease flare-ups, and exercise helps strengthen muscles and improve joint function. There is no specific test to confirm reactive arthritis. A diagnosis usually requires combination of physical examination and laboratory and radiological examination. Okay, so that's the third arthritis. The fourth arthritis we're going to talk about is one that I mentioned last week, and this is rheumatoid arthritis. So rheumatoid arthritis and osteoarthritis are the two big elephants in the room, because these are the most common arthritis that affects individuals. So as an autoimmune disease, rheumatoid arthritis is a type of inflammatory arthritis and another one of the more common varieties of arthritis. The body attacks the synovial fluid within the joints. This is a fluid that lubricates and cushions the joints during movement. Rheumatoid arthritis can affect any joint, but it is often found in the hands, wrist, and feet. Some cases will see an impact to internal organs such as the eyes, lungs, and heart. This disease typically impacts joints on both sides of the body and can lead to deformities in the affected joints. And as mentioned last week, we said rheumatoid arthritis was a symmetrical arthritis. That means it usually affects both sides. In comparison to osteoarthritis, which is asymmetrical, you can have it in just one hip or one arm and not both. Okay, so rheumatoid arthritis can affect any joint, but is often found in the smaller joints, as I said before. The disease typically impacts joints on both sides of the body and can lead to deformities of the joint. Like other varieties of arthritis, symptoms include redness, swelling, pain, or feeling of heat in the lining of the joint. Unlike other types of arthritis, symptoms of rheumatoid arthritis may include fever, fatigue, and loss of appetite. There are cases also where individuals have a low iron count when they have rheumatoid arthritis, or they become very anemic. The pain may last for months, but there may be periods where you are symptom-free. And again, there are periods of flare-ups. Untreated rheumatoid arthritis has significant morning stiffness that can last from half an hour to several hours. Again, if you guys watched the live from last week, this was one of the distinguishing factors between osteoarthritis and rheumatoid arthritis. Osteoarthritis, one will only experience stiffness for half an hour or less. But if you have stiffness for more than half an hour or several hours, that's a distinguishing factor that it's rheumatoid arthritis you're suffering from. So, okay, so that's it for rheumatoid. Now, the next arthritis of discussion is gonna be psoriatic arthritis. Okay, so psoriatic arthritis affects between 10 and 30% of people with psoriasis, and that's where it gets its name from. This is an autoimmune disease. Psoriasis of the skin is linked to joint inflammation. Skin issues usually present before the joint problem starts. Psoriatic arthritis is common in the outer joints of the arms and legs. You will see it occur around the heels, on the side of the elbow, and the outer side of the hips. In addition to inflammation in the joints, there may also be back and neck ache, swollen fingers or toes, and pain in places where tendons and ligaments attach to the bone. Treatment include medication, exercise, rest, techniques for joint protection, surgery, etc. There is no cure for psoriatic arthritis, but starting the right treatment early will have a big impact on how you can manage. And that goes for any of the arthritis, or a matter of fact, any disease. The sooner you start treatment or start to manage it, it's the better. Okay, so now the next arthritis is fibromyalgia. And these are more uncommon, but they still, they still affect a large amount of the population. So fibromyalgia, this mysterious pain syndrome resembles other arthritic conditions more than you may imagine. Morning stiffness and terrible fatigue are common complaints, but other symptoms can vary widely and stretch into every corner of your daily life. If you have been diagnosed with another type of arthritis, you could also be suffering from fibromyalgia. Yeah. In many cases, lupus, fibromyalgia, and rheumatoid arthritis, along with ankylosing spondylitis, often occur together. The other arthritic condition causes the inflammation, heat, and redness you see around the joints. The musculoskeletal pain of fibromyalgia is very real, but it brings no visible symptoms. So that's one that's very hard to diagnose. Okay, the next one, I have about 3 or 4 more to go, so bear with me. The next one is gout. Gout is a type of inflammatory arthritis caused by too much uric acid in the body that is not properly flushed out by the kidneys. So if we don't drink a lot of water to flush our system out, we can retain a lot of uric acid, which can develop into gout. Uric acid crystals build up inside the joints and surrounding tissue, causing painful flare-ups that can last for weeks. Gout most often affects the big toe, and redness, swelling, and intense pain, but the uric acid can also accumulate in the ankle, knee, foot, and finger, elbow, and wrist. But usually, classically, gout, usually it's in the foot, and usually the big toe is where it usually starts. The buildup of urate crystals can start to form hard bumps beneath the skin. Recurring gout attacks can cause damage to new joints or permanent damage in joints where gout has already occurred. Gout is tricky, as flare-up can be followed by long periods without symptoms. You may think that your gout is cured when it's just in a dormant state. The disease becomes more severe over time, but treatment with medication, healthy diet, and other lifestyle changes can help alleviate the pain. All right. Next type of arthritis is ankylosing spondylitis. Ankylosing spondylitis is an autoimmune condition that attacks locations where tendons and ligaments attach to bone, primarily within the spine and the joints that attach the pelvis to the spine. So anywhere you have ligament and tendons, basically you can have this type of arthritis. This type of inflammatory arthritis causes bone erosion, and the body tries to mend the damaged site by forming new bone. The creation of new bone may result in bone fusion and cause deformation of the spine and dysfunction to the shoulders and hips. So yes, those joints usually over time they fuse together, and sometimes the back in the lumbar section of the spine, if those fuse together, then you can get a condition where you have the vertebrae, they becoming square. They just get out of shape and can cause limited movement in the spine. Arthritic symptoms of pain and stiffness are present in this condition, especially in the lower back. The condition is most common in Caucasian males. A vast majority of those affected have HLA-B27 gene, which means that it's hereditary. Okay. Treatment should start immediately upon diagnosis to keep the joints mobile and the spine flexible. A combination of medication and exercise is recommended. Okay, so moving along, the next type of arthritis is called tendinitis and bursitis. Unlike osteoarthritis, which targets the cartilage, and ankylosing spondylitis, which fuses bones, tendinitis and bursitis are soft tissue rheumatic disease. This means the connective tissue and cushioning compounds in the joints become inflamed rather than hard, immobile parts of the joint. As the name implies, tendinitis targets tendons. That's the flexible cord of strong tissue that connects muscles to bones. Although tendinitis can result from overuse or injury, it can also be a rheumatic disease and develop without an evident source of trauma. Okay, so the next arthritis, there are quite a few of them, juvenile arthritis. And by juvenile, I'm sure everybody will suspect that this happens in young children. While it is not a separate disease in itself, juvenile arthritis, also known as pediatric rheumatic disease, affects children that are 16 and younger. It can be either degenerative or inflammatory arthritis, depending on the type. Juvenile arthritis, severe as an umbrella term, serves as an umbrella term for several types of arthritis that affects children. The most common being juvenile idiopathic arthritis, in which up to 6 subtypes of autoimmune disorders can be grouped that impacts children's joints. Some types of juvenile arthritis may impact the musculoskeletal system, eyes, skin, muscles, and and gastrointestinal tract. Indicators of juvenile arthritis are constantly sore joints, swelling, exhaustion, fever, and stiffness. As there is also no cure for juvenile arthritis, the objective of treatment is to relieve pain and inflammation through medication, exercise, and dieting. The next arthritis is polymyalgia rheumatica. Like fibromyalgia, polymyalgia rheumatica brings widespread achiness and stiffness, but only people older than 50 are at risk of developing the disorder. Since it doesn't cause visible swollen and red joints, it can be very difficult to discover and properly diagnose. The condition typically manifests in white seniors over the age of 70. The pain and stiffness commonly occurs in the upper arms, neck, lower back, and thighs. Like other forms of arthritis, symptoms are generally worst in the morning, and it can take some time to restore your mobility. Luckily, polymyalgia rheumatica often responds very well to corticosteroid treatment. Okay, so the final one we are discussing, and most individuals may not think it's a type of arthritis, but lupus. Systemic lupus erythematosus is the medical term. It is also a type of arthritis. So lupus is considered a less common type of arthritis that ranges from mild to severe pain. It is an autoimmune disease that affects the skin, joint, heart, kidneys, brain, lung, and the blood. Due to the various locations lupus occurs, it affects many types of connective tissues throughout the body. Symptoms include chest pain, fatigue, fever, mouth sores, sensitivity to sunlight, swollen lymph nodes, hair loss, urease, and sometimes a butterfly rash on the face. In addition to typical arthritis symptoms, so you'll have your pain, swollen joint, redness, and so on. Diagnosis of this disease can be difficult as lupus symptoms often mirror those of other ailments. This inflammatory disease can affect anyone at any age, but it is found mostly in women in their childbearing years with African and Asian ancestry. While there is no cure for lupus at this time, treatment involves both medication and lifestyle changes, which include non-steroidal anti-inflammatory drugs, so your NSAIDs, corticosteroids, immunosuppressive agents, a clean diet, rest, and regular low-impact exercise. So, this has brought me to the end of the list. This is by no means all the arthritis, but these are the more common ones that we see in the population. So arthritis is a widespread condition with many varieties, and its affiliated disease only make the list longer. Popular recommendation for treatment for most of the conditions include switching to a healthier lifestyle, taking care of your joints, and what else? Exercise, losing weight, and so on. So, thank you for listening. I have one person here left, but that is, in a nutshell, the overview on the different types of arthritis. Anyone have any comment, any question? Welcome, Donette Borrell. Let me see who else is here. Let me see. Only one person is left. Oh, that must be Dwight. Yamo be there. It must be Dwight. Okay. So as I announced last week, it's already 9:02, so I'm going to be brief and then close out the session. Again, thanks to all the persons that dropped in, whether it's for a short time or you stayed to the end. I'm very grateful and I appreciate your presence. Now, last week I announced that I'm going to give away $100 when my channel has 1,000 subscribers. That's the first prize. The second prize is going to be 1,200 Digicel minutes and some merchandise. And the third prize will be 600 Digicel minutes and merchandise. So, anyone interested, try to share the live and my other videos. I have 3 channels. I have Housewise TV that deals with building houses and the process in Jamaica. I have Aces Merch. That's my t-shirt shop. I make other custom make products too and sell other items. I'm also an Amazon affiliate. So if you jump on my site and click on my Amazon links, you can go over to Amazon and purchase things over there. And so next week, again, I'll meet again with Answer Me TV. On Tuesdays, I would like to have a live every Tuesday at 8 o'clock for my Aces Merch store. Show the process of making a lot of the custom things that I make, mouse pads, t-shirts, and the equipment that I use and so on. So I'm going to try to do that on Tuesday nights. So again, it's after 9, so thanks for coming, and I'm going to post this live on YouTube. So see you. Anybody have anything to say? You can type it in the comment here. If you have something to share, you want to add something to what I said, go ahead, and then I'm going to close out. Thanks for coming, Yamo be there. What a name. And special thank you to Dorette Borrell. And I didn't even see when Dorette is a woman. I didn't see when she come on. But next week, same place. Good night.